We'd always read a book before bed.
Christina Heckes says her daughter Quinn started feeling sick last March, just a few weeks shy of her 6th birthday.
We did the things every parent does, the Tylenol, the Advil.
By phone, a doctor told Heckes it was likely just a lingering cold. Suddenly, her daughter took a turn.
Her breathing is labored. Nothing's happened with her fever. It's been 3 days. I said, okay, that's it, no more. We're going to the hospital.
X-rays showed Quinn had pneumonia, and later tests showed her organs were failing. She died within hours.
I don't know how to tell other people how fast it was. My daughter was sitting, watching a movie, having a conversation with her nurses, and not 6 hours later, she was gone.
The cause, a common bacterial infection. Group A streptococcus is usually linked to milder illness like strep throat. But in some cases, bacteria invade the bloodstream, rapidly causing sepsis, even death. New national data provided to CBC News shows infections have spiked, with 4,600 reports of invasive strep A by the end of 2023, the highest annual total recorded in Canada.
So we've been seeing an increased level of invasive group A streptococcal disease.
Ontario officials say in that province, 48 people have died this season, including 6 children.
It's really difficult, of course, for the families and those caring for them. It's something we're tracking closely.
2 people have died so far this year in New Brunswick. And in December, BC officials warned there were twice as many cases of invasive strep among people under 20 than the province expected. Warning signs include a fever, dizziness, confusion, or intense pain. Those symptoms require fast medical attention and antibiotics. But
even though that's the right drug for the right bug, there isn't a 100% success rate.
So Lauren, given we're talking about something that can be deadly even with treatment, how concerned should people be?
Well, there's no cause for panic. Most of these cases are mild, but when strep goes downhill, it happens fast. So for parents watching, go with your gut. If you think you or your child is seriously ill, even though ERs are busy, you want to get to a hospital.
And how do you protect yourself from it?
Well, you can't get a vaccine for strep. It's a bacterial infection, and there's really no way to prevent it with a vaccine. So what we do know is that serious strep can piggyback on other illnesses. So if you have a viral infection like COVID or the flu, it can actually make it worse if you get strep on top of that. So the only option is getting a vaccine to protect you against those viruses. It's one of the only tools we have.
All right, Lauren Pelly, thank you.
Thank you.